I'm Carla Macias, and welcome back to another episode of the Best Docs Network featuring Forest Park Medical Center, San Antonio. In the next 30 minutes, we're going to take a look into one of the top medical facilities in all of Texas, bringing you the best of the best from equipment to techniques. Now let's introduce one of those Forest Park physicians, Dr. Daniel Saltzstein.
The initial problem was that I was having recurring urinary tract infections, and we couldn't seem to get our hands around it. And then Dr. Saltzstein did some scans and determined that I had kidney stones in both kidneys.
When I consulted Deborah on her options, I felt like surgery was absolutely indicated. She had stones that were infected, and unless we removed those infected stones, her infections would continue and she would probably have continued deterioration of her kidney function.
My understanding from what Dr. Saltzstein told me that my case was very severe. Both kidneys were full of stones. He suspected that they were infected stones, which complicated things quite a bit.
Deborah ended up requiring 4 surgeries to completely get her stone free. We did 2 percutaneous nephrolithotomies, and that's where you put a tube in the kidney and remove the stones through that tube. You can use I call them jackhammers, laser devices, suction tubes, so we can get the larger stones out. She also had what was called lithotripsy, or EHWL, where we shocked the stones that were remaining, and she had 1 ureteroscopy where we went from below and took our telescopes to get her stones out.
The recovery process was pretty extensive. I found that after the first procedure, the invasive procedure on the first kidney, I lost a lot of blood. I had very little energy, and I also went home with a tube and a bag, which I really wasn't expecting. So I missed quite a bit of work, and it was just a matter of getting my strength back so that I could be ready to do the next procedure. I would say that Dr. Saltzstein and these procedures both changed my life. I feel very good about what he did. I feel very good about where I'm going in the future, because he's going to monitor and make sure that I don't get in a situation like I was in before. So yeah, my life is so much better today.
Kidney stones are extremely common in San Antonio and South Texas. One word of advice if you don't want to have to visit your friendly urologist at the emergency room is to go ahead and drink lots of fluids. A couple of glasses of water keeps the doctor away.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. Fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
At Forest Park, we call it the 6 senses of Forest Park, and you have your conventional 5, and it talks about the experience that you get from the minute that you come onto our campus. So we're really kind of playing into those senses. So what are you seeing when you first get on the campus and walk into our hospitals? Are you looking at just great architecture? Or are you looking at a brighter environment, with natural sunlight and things of that nature? The art program is something that plays into the healing aspect, the visual aspect. So you'll see sculpture, you'll see original pieces, you'll see prints, you'll see a little bit of everything. And the way that we attack art is you should feel a little bit uncomfortable with art, because if every piece of art in our facilities was something that you absolutely loved, then you probably didn't reach the entire community, because we all have different tastes, different aspects of what we like. What are you smelling? We have engineered scents in all of our hospitals to where it's an engineering system called ScentStream, and it's built into our HVAC, and the scent that Forest Park has chosen is called Clean Sheets. But other things that you have just kind of coming into our environment is, what type of food are you having, the taste. We don't have cafeterias, we have dining facilities. What are you hearing when you come onto our campus and into our facility as well? Oftentimes in every facility that we do, we have water features, both outdoor water features and interior water features. So it provides a calming type sound that resonates throughout our facilities. What are the things that you're feeling? We have a lot of textural elements associated with our design. When you're coming in, the textural walls, whether it's the stone-cut exterior of a lot of our facilities, or when you're coming inside and you're feeling the texture of the fabric itself. We really try to play into all of those senses for our patients. So, whether it's in the lobby or it's in the patient rooms, or the thread count on the sheets, those are the type of textural elements that really you may not instinctively know about those, but when you actually touch it and feel it, it'll make a difference to you. Every one of our facilities is a minimum of LEED Silver. So what that means is it's our environmental impact to the community as well. So we have rooftop gardens where you have lush gardens that can be seen from all of our patient rooms. You're seeing planting, you're seeing stone, you're seeing in some cases water features associated with even our green roofs. But it's something that really kind of plays into the sixth sense of Forest Park, which is heal. And having a patient room that looks down onto grasses and trees and plants, and it intrinsically has a healing aspect that really our patients have grown to appreciate. Again, we're playing to each of those senses, and then our sixth sense is heal, because at the end of the day, that's why we're here. We're here for the community, we're healing patients, and providing a place for our physicians to practice medicine. Walking onto our campuses, from step one, what we really kind of focus on is that entire experience. It should look and feel not like a hospital, but it should look more like a hotel. You're really seeing something different. It has a completely different feel from anything else that you've seen in the market. Our job as developers and as Forest Park Medical Center is to deliver a facility that's different than what the physicians are used to, what the patients are used to.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine, Forest Park Medical Center. Nathan has a question for Dr. Growney. If I have continuing chronic knee pain, what would you suggest?
There's several options available. One is we need to make sure there's nothing structurally wrong that would possibly be helped with an arthroscopic surgery, or in some cases if a knee is degenerated to a point where you're a candidate for the knee replacement. But we have, as pain management specialists, a newer option that we've been using that includes people who don't have a good surgical option, or they've already had knee surgery, or they've already even had total knee surgery, but continued pain in the knee. And we've got a pretty good option that's a new technique where we'll block certain nerves, and we can even do radiofrequency of those nerves for a long-term benefit. Some people 6 to 8 months or even a year of relief with blocking those small sensory nerves.
Primary care medicine is devoted to the comprehensive health care for people of all ages. Dr. Gerardo Vazquez is a primary care physician here in the San Antonio area. Now let's meet the doctor.
I've been doing this primary care for the last 28 years. Keep on assisting a neurosurgeon in brain surgery and spine surgery just to keep my hands in the field. But lately I decided to go full-time, chosen my clinic, and we're enjoying a lot. Due to the background, it makes it really, first of all, enjoyable, and with the experience of the training and allowed me to treat the patients with on broad spectrum. And one thing makes me so happy in San Antonio, we have a tremendous force and specialists. So our job is pretty complete. We can really develop and provide good primary care in San Antonio.
Did you know Forest Park Medical Center is known for having larger than average operating rooms? Larger ORs allow doctors the flexibility to house groundbreaking technology such as the Da Vinci robot, the Makoplasty robotic arm, and Acessa that helps improve minimally invasive and accurate procedures.
The physicians at Forest Park Medical Center strive to educate their patients as well as the community. Now let's take a look into breast screening as we learn the differences between mammograms versus MRIs with radiation oncologist Dr. Lillian Chou.
Once you saw this mammogram, you can tell that the skin here is normal. But if you look at the skin here, see how much thicker this skin is. But if you look at her breast doesn't show you a certain spot that is having issue. There is no microcalcifications that look suspicious, and there is not a tumor that you can pinpoint to, nothing. So you know that there's something going on. It could be just a simple inflammation causing, or mastitis causing this skin thickening. But it turned out that the patient had a really big cancer. This is the same patient that we just saw on the mammogram. This is the MRI, Aurora MRI. You saw there's an abnormality there. And when we go to this panel, you see there's redness, this red area here, those are all cancer. And the blue area, that's the swelling of the breast. So it's very diffuse. And the blue area is the swelling associated with the cancer. Our MRI can do three-dimensional. You can see the chest wall, the heart, and the armpits, the axilla, and the nipples here. And you see the difference between the two breasts right off. There's something going on here. See the difference between this breast and that breast? The redness is all cancer. There's a big difference between what mammogram and MRI can see. Mammogram is two-dimensional, and the density all jammed together. So it's very hard to differentiate a dense breast tissue versus a cancer. Now MRI, you can tell right away. This is a breast ultrasound. And this is at 3 o'clock position of her breast. And because after the MRI, we already kind of know where the problem is. So we use the ultrasound to focus where we can sample. And that's where our needle went through here to get the diagnosis of cancer. This is where ultrasound shows some abnormality. We are using the ultrasound, we call it a second look ultrasound after the MRI, and zoom in on where the problem that we can see on the MRI, and using ultrasound to guide our biopsy needle. And we sample that area, and it was cancer.
Eating eggs for breakfast not only tastes good, but they help to slim you down too. Each egg you eat has 6 grams of protein, but only 72 calories.
Select Art I started about 28 years ago. It's a private gallery, and I specialize in providing art for public spaces, and primarily doing
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
By heading over to bestdocsnetwork.com and clicking on Forest Park Medical Center under the Our Doctors tab, you can request an appointment with any of the doctors that you see on today's show. Just like our next doctor, breast reconstruction specialist, Dr. Gary Arishita.
I was very glad that this option was out there for me, because not only did it give me my confidence back, it helped me to appreciate life more. Dr. Arishita and his nurse were wonderful. They always made me feel very comfortable. It was their main goal to make sure that I was satisfied with the procedure.
I had two surgical procedures at Forest Park. I had bariatric surgery in September, and I've had my back surgery in April of this year. The staff at Forest Park was cordial, respectful. The checking in process was done efficiently. There were no surprises. They had called me the evening before to remind me of what I needed to do to prepare myself. I sat in the waiting room a minimal amount of time before I was called back to begin the pre-op procedure. In both cases, I was in on one day and I was out the very next day, and felt very comfortable during the process.
Just walking in, it did seem like a five-star hotel, but we were greeted at the desk by the concierge. They gave my husband a pager and explained to him what the paging system was like. They would send him a text how I was doing in surgery, where I was at, everywhere in the hospital. He was able to see at any screen where I was. And so it gave him a great sense of comfort knowing that, you know, he was being, even though it was electronic communication, that still somebody was letting him know as I moved through the progression of the surgery area, the recovery area, back to my room. He knew. It was incredible how the staff made sure that my family was taken care of while I was being taken care of.
I felt like I was in a 6-star hotel. The service was great. The people were wonderful. I really felt that I was treated as if they really cared about me and wanted to help me and get me to start recovering quickly.
And I felt really good being there. I didn't feel like I was in a sterile environment. It just felt homey. And that was nice because, you know, when you're not feeling good, it's good to be in a place that feels like home. And it was a place that felt like home. And my husband was able to stay overnight with me
The nurses, the staff, everyone seemed really happy and ready to help you out. Where I've been to hospitals where it just wasn't like that. The rooms at Forest Park were extremely clean. The exterior, when you first see Forest Park, it does look like a 5-star hotel. Everything about it was a good experience.
As we see it, advances in medicine have as much to do with patient comfort as with medical technology. Oh, at Forest Park Medical Center, we invest in medical technology as much as any hospital in North Texas. It's just that we invest in other things as well. You see, Forest Park Medical Center was designed for warmth, designed for comfort, designed for, dare we say it, our patients. Come see for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
Dry cough is a very common problem that affects a lot of people, and sometimes it even interferes with their sleep, and it may lead to urine incontinence. A cough is not a disease, but it's a symptom of an ongoing disease. Things that can cause a dry cough are reflux, postnasal drip either from allergies or from chronic sinus infections, bronchitis, asthma, and sometimes even medications. For example, when you're taking ACE inhibitors, which are medicines for blood pressure, like enalapril and lisinopril, you might have a cough from these. So discontinuing these medications will usually resolve the cough within the next 2 weeks. Allergies are one of the most common conditions that will lead to cough, and patients usually experience postnasal drip. Sometimes they'll also notice itchy eyes or itchy throat. Treating it with an antihistamine and with anti-inflammatories like nasal steroids will help to reduce the cough. In other patients, the cause of the cough could be what we call silent reflux or LPR. As opposed to patients that have the common reflux, what these patients experience is no heartburn at all, but they may have this chronic dry cough. This is usually treated with medications that reduce the acid. Cough can also be a sign of a serious illness. For example, chronic bronchitis, pulmonary emphysema. It could also be lung cancer. So make sure that you talk to your doctor if you've had a cough that's lasted more than 3 months.
By heading over to bestdocsnetwork.com, you can check out all the specialty doctors involved with Forest Park Medical Center. Each doctor has a page dedicated to them where you can seek hundreds of other informational videos. One of these doctors is orthopedic surgeon Dr. Gerald Greenfield.
I was at cheer practice and I was coming down from a stunt called a peg leg, and what you do is you land on one leg, and I had locked my leg out, and when I locked my leg out I landed straight on my leg and it kind of buckled underneath me, and that's when I kind of heard a pop, and that was when I tore my ACL.
The ACL is one of the stabilizing ligaments of the knee. What the ACL does is it stops the tibia, the shin bone, from sliding forward. So in certain injuries, usually contact injuries, but oftentimes non-contact, twisting type injuries, the torque that's applied on the knee can be so much that it ruptures the ACL, it tears the ACL.
My first visit with Dr. Greenfield, he saw fluid in my leg, and that was one of the telltale signs of a torn ligament. And he wanted me to go get an MRI, and I got the MRI done that day. It was very quick. The results of the MRI was that I had a torn ACL and that I had a medial meniscus tear in my left leg, and that I would need surgery very soon.
Repairing the ACL can be done in children and younger kids who may have just pulled the piece of bone off. But in older patients, and we'll say older or teenagers and above, it's oftentimes necessary to reconstruct that ligament. Basically to take tissue from somewhere else, whether it's somewhere else on that person's body or whether it's a donor graft, put that in to reconstruct or replace the ACL. And in doing that, we can restore their function, restore their stability, and improve their long-term longevity in their knee.
Me and my family decided that the best option for me was to go ahead and get the surgery because Dr. Greenfield had explained that I would have issues walking later on in life, and I didn't want to experience that, and we thought it was better to go ahead and just fix it now. Today I feel great. I can do whatever I want to do. I can do gymnastics, I can run, I can go exercise with my friends, and I never have problems with my knee, and if I do, I can just put on my knee brace and that takes care of all the issues.
Smartphones and on-the-go technology are on the rise, causing Americans to use headphones more often. But did you know that wearing headphones for just an hour could increase the bacteria in your ear by 700 times? Stacy has a question for Dr. Pilcher. Is it silly to say bariatric surgery is the easy way out?
This surgery is definitely not the easy way out. It's a courageous way out. This comes from people who are intelligent and forward-thinking. They've already tried to diet and exercise. Maybe they lost 20 pounds, gained back 25, and these are people who are just not ready to keep doing the same thing over and over again. Surgery involves a huge commitment. It's a commitment for life after surgery. It's a commitment to lifestyle change. It's a commitment to follow-up, and it involves a little bit of risk as well. So this is not definitely the easy way out.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way. And that'll do it, everybody, for this week's episode of the Best Docs Network featuring Forest Park Medical Center, your destination to better health. For more information on any of the San Antonio doctors that you've seen on today's show, head to our website, bestdocsnetwork.com. If you got any questions or comments, we would love to hear from you. So email us at info@bestdocsnetwork.com. So long, everybody. We will see you next week.